So, welcome to the webinar which sets out the Nottingham and Nottinghamshire's joint strategic needs assessment for autism. I'd like to introduce our panel. So if I can hand over to Anne and the rest of the panel to introduce yourself, and then the presentation. The format is there is a presentation which will set out the key themes within the chapter. There is a chat function, so do feel free to pop in comments or questions as the presentation goes on, which we will then put to the panel. And similarly, after the presentation, there'll be an opportunity if you wish to either put a question in the chat or pop your hand up and come on screen and ask the panel a question. So welcome everybody. I'll pass over to Anne and the panel. Thank you.
Morning everybody, I'm Anne Tebbs. I'm Senior Commissioning Officer at Nottinghamshire County Council. I'm really pleased to see so many people have taken the time this morning to join us. I'll be running the presentation today for the most part, but very helpfully my panel members have also joined us. I can't see you, but I know that you can see me. I'm sharing the slides, so please use the chat to ask any questions, and when I stop sharing we'll be able to kind of back engage with you guys. James, I don't know who's next who wants to introduce themselves.
Thank you. If we do Katie, Charlotte and then Vicky, thank you.
Hi everyone, I'm Katie Ross. I'm the Lead Commissioning Officer for LDA at City. Very excited to be here today, supporting my colleagues. Thank you.
Hello, I'm Charlotte Redding and I am Head of Learning Disabilities and Autism Transformation and Commissioning for the ICB.
And hi, my name is Vicky Romley. I'm a speech and language therapist by background, and I'm in a new role, which is a consultant in learning disability and autism. Thank you.
Right, everybody. So we've got about 20 slides to run through this morning. It's quite a long presentation. I'm hoping to be finished by about 11:30, so we can have half an hour of good conversations. The first slide that I'm going to kind of pause on is a short film, and it would just be an opportunity for everyone to kind of relax and just introduce autism in a much more comprehensive way than I'm going to be able to capture. So thank you for joining us. The Joint Strategic Needs Assessment was written over the course of I guess about 12 months, but actually the real kind of writing happened last year. Everybody across the integrated care system has contributed to this Joint Strategic Needs Assessment and really pulled together to think about how we understand our autistic population in Nottingham and Nottinghamshire. So it's a county-wide, city-wide, health-wide, social care-wide piece of work. So I'm really proud that we've all come together and done this work together with colleagues on this call and more colleagues who aren't able to be here today. So next slide. Oh, strange. Next slide. Here we go. We're introducing autism. I'm sure many colleagues on the call will have a huge amount of experience working with autistic people. We may have colleagues on the call who are autistic people. This slide is just introducing how we're talking about autism in the JSNA, how we're talking about the differences that some autistic people may experience as difference in processing, preference for routines, difference in sensory processing. I guess the headline is that, you know, when you've met one autistic person, you've met one autistic person, and people will experience autism in very, very different ways. I think that is probably most helpfully described in this very short animation that we're going to share with you. And it's definitely going to work. Oh.
Neurodiversity. Neurodiversity is like biodiversity, but instead of being about trees and plants, it's about human brains. Biodiversity means that there are lots of different types of plants and animals. If we focus on flowers as one type, we know that although we usually imagine flowers to look and act in a particular way, there are lots of different groups of flowers. If you had to draw a picture of a flower, some groups of flowers would look and act how you have drawn your flower. Other groups of flowers might look and act very differently. Each individual flower on planet Earth is unique. There is no other flower quite like it. Yet every individual flower fits into a different flower group, each of which is different from other flower groups, but all those groups are classified as flowers. Instead of being about flowers, or dogs, or trees, or fish, neurodiversity focuses on human brains. Neurodiversity includes all human beings. There are around 8 billion human beings on planet Earth. Nobody exactly like you has ever existed or ever will exist. You are completely unique in your personality and how your brain works. Your brain might, though, work very similarly to some humans, but also very differently to others in very specific ways. When this happens, your group is identified as neurodivergent and might have a label like autism or ADHD or one of many more labels. When your brain works similarly to the majority of people, we call that being neurotypical. Sometimes people are aware when they are different, but not know why. Some people can think they are neurotypical when they aren't, and sometimes it takes someone else to recognize that you are neurodivergent. There is nothing right or wrong about being neurotypical or neurodivergent. It just means that brains work in a unique way. If you are neurodivergent, it usually means that you need to learn differently to neurotypical people. You might concentrate differently, behave or act a little differently, even communicate and think differently. Needing more support around this is okay, because unfortunately the world we live in is very focused on meeting the needs of neurotypical people because it's more common to be neurotypical. This isn't a problem with neurodivergent people as people. This is a problem that society needs to fix, because neurodivergent people are as an important and natural part of the world as neurotypical people are. Too often, the neurotypical world forgets or isn't really aware that people can and do exist differently and have different needs. So it assumes that we must have bodies that work in the same way, have brains that work in the same way, do things in exactly the same way, think the same way, communicate the same way, act the same way, must respond to things the same way. When people don't meet those standards, they are often seen by doctors and professionals who give them labels that tell them the ways that they don't work properly. They're told they have a disorder, they have conditions, they're not fully functioning human beings. We accept that every single type of creature and plant on the planet has members that look and act very differently. But we don't accept that for humans. All humans are expected to be the same. We need more people to recognize and understand neurodiversity, because the way neurodivergent people are treated can be very negative, and there are a lot of myths. In your schools and classes, you're very likely to meet people who are neurodivergent. Sometimes you will know, sometimes you won't. The labels you are most likely to have come across are things like autism, ADHD, blindness, dyspraxia, dyslexia, deafness, dyscalculia, dysgraphia, Ehlers-Danlos syndromes, Down syndrome, learning or intellectual disabilities. It's really important to remember that these labels don't mean that someone is badly behaved or ill in some way. It means that what they need might be a little or very different to what you need. Sometimes you will meet people who have different needs who don't know that one or more of those labels might apply to them. One or more of those labels might even apply to you, your friends, your parents, or your teachers and you, or they might not know. The best way to recognize someone who is neurodivergent is when someone, a little or a lot, might communicate differently to most people, might process information differently to most people, might behave differently to most people, might move differently to most people, might need to use their attention differently to most people, might react to sensory information differently to most people, might play and socialize differently to most people. These differences are part of who that person is and what makes them unique, and it is so important that you or anyone does not try to change how someone else needs to exist.
Right, everybody, let me just get the slides back up for you. Ooh. Sorry, everybody, just dealing with some technical issues. Okay, so we really wanted to share that video with you because I guess it really summarises to us the main theme of this joint strategic needs assessment. We wanted to kind of promote to everybody in Nottingham and Nottinghamshire, I guess, introduce the idea of neuroaffirmative practice. So that's a philosophy and social movement recognizing that the need to work towards neurotype rather than disorder. So that thing in the video where they say, actually, you know, we need to accommodate everybody's needs. We need to think about people as people and individuals that have different needs. And if we accommodate those needs, actually people will experience a much kind of fairer community. In the JSNA, we start to introduce that idea. I think we've had feedback from people with lived experience that actually we don't go far enough to introduce that idea. So I really wanted to highlight that in this presentation today. We know that some autistic people consciously and unconsciously try to mask their differences. And actually that has a really negative impact on their health and well-being. It's really exhausting. And what we want to achieve or get people to start to think about Nottinghamshire is how we can make adjustments for that individual. How can we enact our responsibilities under the Equality Act? There are many ways that communities and services can adapt, adjust and personalise their approach. And some of those are very small changes that we need to make. There's been a big focus nationally around building awareness for autism. However, I guess what we're trying to do in Nottinghamshire is move to the next phase, which is where we accept our autistic population and we really start to kind of make adjustments and adaptations to eliminate that stigma, embrace autistic people's strengths and reduce inequalities. So that's what we're trying to introduce in this JSNA. In Nottinghamshire, we have a established learning disability and autism executive board. So there are governances and ways that we can work together to change things across our system. The board is made up of a range of representatives. It includes experts by experience. We have 2 experts by experience who sit on that board. We also have colleagues and representatives from both Nottinghamshire City Council and Nottinghamshire County Council. We have representatives from Nottinghamshire NHS Healthcare Foundation Trust and our mental health services. And we also have representation from our ICB, and all of those people are represented on our panel today. There's an opportunity to improve the governance, and that's something that this JSNA has highlighted. We think that we could have oversight across the structure to ensure the broader concerns for autistic people and their families are prioritised. And we really welcome groups like the Autism Alliance, which is working to try and promote a protected space for autistic individuals and allies to challenge existing structures where necessary. So I guess this slide is kind of showing that there is a system in place. There are kind of system challenges and people working together to challenge our system to increase kind of the adjustments and adaptations we can make for autistic people. But we think it can be strengthened. So as you probably all know, broadly estimated about 1% of the population are autistic. Actually, prevalence in Nottinghamshire is tracking higher, and that's fairly typical of a kind of national picture. As you will undoubtedly be aware, there are increased assessments in children and young people, and this graph really shows that. So you can see the number of males and females at a younger age that are being assessed for autism and assessed as autistic, and that actually kind of really is very small in our older population. There's lots of reasons why we're seeing more diagnosis at a younger age and less at an older age. I guess a lot of that is about increased awareness, but it's really difficult to understand who are our autistic population, because you will have lots of people who are not assessed or would never even think about having an assessment, or who are waiting for an assessment. So understanding how many autistic people in Nottinghamshire is not easy. We know that there are more autistic males assessed for autism than there are females. That's true across the city and the county. Autistic women and girls face health inequalities. Autistic women with a learning disability among those at highest risk of an early death in the autistic community. There are definite inequalities for autism and gender. Autistic women are also markedly more likely to die by suicide than non-autistic women, and report having a lower quality of life than their male peers. And we also know, and it's detailed in the JSNA, how often women with autism can describe masking and camouflaging their autistic traits, and that can make assessment and diagnosis obviously a bit more difficult, or identifying that somebody even may benefit from an assessment a bit more difficult. We also see similar trends in different ethnicity groups. We've got quite an ethnically diverse population in Nottingham, particularly in the city, and nationally and locally, assessments track slightly lower than the white British population, which is represented in the JSNA. There's more information. We'll share the link so you can read about it. The National Autistic Society report Diverse Perspectives, published in 2014, found that some communities lacked an understanding of autism, which could lead to stigma and shame. In addition, there's a lack of confidence and mistrust in professionals in some communities, and other barriers to accessing services where people may get an assessment or get support. As you will know, there's no definitive test for autism. Assessments are based on the range of features evaluated by a combination of professionals. There's lots of reasons why somebody might want to have an assessment for autism. It can be really validating for the individual. It can enable them to have a gateway to services that they might not previously had. And it can also facilitate connection with other autistic members of the community. As I'm sure you'll be aware, demand for assessments locally has nearly doubled. Investment has been made to increase capacity for assessments, but certainly we're in a system that is struggling to manage the number of the demand on our assessment services. As we saw from the population slide, there's a national prevalence of autism in children and young people, which has increased from 1% to 2.8%. Many children and young people may not have a formal diagnosis, or may be on a waiting list waiting for an assessment. I'm sure there'll be people that you know, your family, your friends, and people that you're working with who are in that similar situation. Nottinghamshire Integrated Care System have reviewed the diagnostic pathway for children and young people. They published their report in April 2024 and are working through some of the things that families and carers told us of people waiting for an assessment. Delays to assessments were absolutely identified as part of this report, but what was also identified was the opportunity to improve people's experiences whilst they were waiting for an assessment, improve the support available to people. So it's another opportunity identified throughout the JSNA. As we know, children and young people face lots of barriers to their health, their education. National Autistic Society have undertaken research that said 73% of autistic children and young people attend a mainstream school, and 3 out of 4 families of those children felt the schools weren't able to meet the needs of the young person. One of the things that the JSNA is really kind of challenging us all to do is think about how we can make changes to our services to really meet the needs of our autistic population who access them, and schools is one part of that, as is the transition between children and adulthood across health and social care settings. There's lots of reasons why that's such a difficult time for people, but it's an area that really makes people feel like they're coming at a cliff edge when they approach adulthood. And actually, we need to find ways as a system to soften that cliff edge for people. We know that there's different legal frameworks in place, but actually, how can we support people to have the best experience and succeed? The JSNA has done a bit of research around autistic people and their well-being. We know that some autistic people are more likely to experience loneliness and feel really isolated. That can be for lots of reasons. They might have experienced, kind of intense bullying, either in their school or in their local communities, which can really leave people feeling really ostracised. They might have an overstimulation to some of the environments where we all socialise. They can be very loud environments, very stimulating environments. So ensuring there are opportunities for autistic people to build networks to meet the needs of the autistic population is really necessary to try and reduce social isolation. It's a real critical factor in impacting the well-being of autistic people. We also looked at employment as part of the JSNA. It's well documented that employment really benefits all of us. Sometimes I know it doesn't feel like it, but actually people who have jobs have developed social networks, friendships, improved independence, economic mobility, and autistic adults have a wide range of skills and interests that we could all really, really benefit from in the workplace. But still, nationally, in 2022 to 2023, only 30.6% of autistic people were unemployed. And I guess the JSNA is saying we're losing out on this workforce, these people that could bring new ideas, new ways of thinking, really help us to implement some changes so that services are more accessible. And yet they're still a very underemployed group of people. As I'm sure many of you know, the majority of autistic people will access generic healthcare services. They'll be going to the same GP services, they'll be accessing the same mental health services as the general population. And there's lots of opportunities for those services to be more accessible for the autistic population. There's evidence in the JSNA that people can be reluctant to go to their GP to seek support. And actually, we could take away some of those barriers if we thought about how we could tweak some of our entry points to healthcare and social care. Really simple things that are outlined. Planned appointment services should try to identify a person's needs before their visit, maybe provide some photos, tell them what it's going to be like, give more information about what to expect when you get there. Where the waiting room is, what's in the waiting room, what to expect, give people more time to process some of the information shared at appointments, give people a bit more choice about how they make appointments. Some autistic people might prefer to make an appointment online rather than via phone. So just thinking about how we can tweak our services to improve them. As a result of challenges in accessing services, we know that autistic people have poorer health outcomes than the rest of the population. Some of these statistics are really, really sad. We know that autistic people die on average 16 years earlier than the neurotypical population. Approximately 1 in 5 women with an eating disorder were autistic. Anorexia has the highest mortality rate of any mental illness. A disproportionate number of people die by suicide are autistic. Ongoing research suggests up to 11% of people who die by suicide have autism. Between 15 and 40% of people with epilepsy are autistic. The National Leader programme that in the past has reviewed the deaths of people with learning disabilities has also done some work to review the deaths of autistic adults without a learning disability. Found the most common cause of death was suicide, drug and alcohol related deaths and accidental death. Ethnicity is strongly indicated as being correlated to a premature death as well. So this is just a bit of a snapshot of the things that are described in the JSNA about the opportunities and the health inequalities of autistic people. think it really focuses the mind to think about some of those. We also know that there are links for poorer mental health in our autistic population. I think this is, again, quite shocking, some of this. 7 in 10 children with autism have a mental health condition, a co-occurring mental health condition, and 8 in 10 adults have a co-occurring mental health condition. Up to 10% of adults in mental health inpatient settings are believed to be autistic. 11% of people who die by suicide are autistic. So factors driving the prevalence of co-occurring mental health include autistic people can experience social isolation, something that we talked about in the wellbeing slide. Sensory sensitivities, common in autism, can also lead to heightened stress and anxiety, particularly in overwhelming environments. It's high rates of bullying and social discrimination towards autistic people. And often mental health conditions are overlooked at diagnosis or misdiagnosed, particularly in children and young people experiencing mental health issues. We continue to see increased inpatient numbers in our mental health settings for autistic people. It continues to increase by 23%, and 53% of people who are autistic stay in hospital for over 2 years. So not only are more autistic people being admitted under the Mental Health Act, but they're staying in hospital for longer. And when we think about some of the things that we know about those hospital environments and the impact on people's sensory needs, actually that's not really the best place for any autistic person to be to recover, particularly their mental health. So having kind of identified some of these key themes in the JSNA, part of the JSNA is to make some recommendations and think about opportunities that we can improve the picture for people, autistic people locally. So there's some recommendations on the screen, recommendations around supporting children and young people. A lot of that's linked to the work already undertaken around the pathway review for children and young people, around assessment particularly. And obviously we've got our special education needs and disabilities improvement plan in Nottinghamshire that we need to enact together as a system. This is not any one person's job. We all have to think about how we can influence this every day. Review the experiences of autistic children and young people transitioning across into adult services. So both across health and social care, what does that mean for that young person? How can we prepare that young person for their transition, make that as positive an experience as possible? We've got a great opportunity as a system. We've got an all-age autism strategy that is ready to be refreshed. We really think that to improve that local picture, we need to work with autistic people to co-produce and really strengthen what those priorities are in that strategy and an action plan, and work across the system to think with people with lived experience how we can make changes locally across health, education and social care. We need to also strengthen our governance structures. We've got a learning disability and autism board, and how can that board hold us to account as system partners? How can we show that we are having impact through this strategy? And we need to improve our data and reporting. So lots of the challenges in writing this JSNA were getting the data. Do we all understand how many autistic people we're working with? Do we have that information to have a really rich JSNA? And the truth is, actually, we really struggle with that. We are working together as a system to kind of think about how we can overcome those kind of identifying factors so that we can better understand our autistic population. Obviously, there's lots of recommendations around health and well-being. We really want to review our local suicide prevention plans, think about the best practice nationally and internationally to think about how we can reduce the number of autistic people who die by suicide. That's a real key aim, as you can imagine. Review the experience of autistic people accessing our local mental health services. Work with people to maybe think about how we can implement adjustments across mental health services to improve autistic people's experiences. Consider the need for a strategy in relation to employment for autistic people. How can we harness the skills and strengths of this population to really bolster our opportunity around employment for autistic people? Think about whether we need to have more toolkits available for everyone working across health and social care and education to reduce inequalities across our services for autistic people. What information do people need? How can people make simple adjustments to the way they work to support better access for autistic people? And we need to continue to support training across health and social care. We have, we all know about the Oliver McGowan training and that being rolled out across health and social care, but how can we go further locally? How can we really think about going from that awareness that we talked about to acceptance and adjustment? We thought it'd be helpful to give you some examples of some of the different ways that we've started to use the information in the JSNA to influence our approach locally across health, social care. And I'm going to let Vicky talk through some of these slides because I think she'll do a better job than me.
Okay, thank you, Anne. Just to introduce myself again, I'm Vicky Romley. I'm a speech and language therapist and consultant in learning disability and autism. I share this slide recognising the sensitivity, but recognising the need to really listen. We want you to make use of this JSNA. We think this JSNA is a starting point for us together to be realigning our thinking, to be thinking collectively about commissioning intentions. And in terms of influencing population health, we do that by triangulating data. And the data that is of most significant importance is listening to people who have experience of utilising support and services that are available to them. And in terms of working towards a better future, we work towards a better future by considering the relationship between statutory providers, services, working with third sector organisations. So this is just one small example of that. And I just want to give thanks to colleague Cathy McKay, who I think is in the audience. Cathy, when it comes to questions, if you do want to make any comments, please do. But Notts Healthcare Trust, funded through the integrated care system, worked with Autistic Nottingham as an example of one organisation to listen to autistic people's experiences of accessing healthcare. I am quite sure that we have a wealth of information from that. I'm also quite sure of the effort and the energy it would take to offer such feedback. So, current mental health services often fail to meet the needs of autistic individuals, lacking both understanding and accountability. Healthcare professionals frequently lack awareness and training in autism, leading to discrimination and inadequate support. The slow-paced nature of the healthcare system makes it difficult for autistic individuals to access timely help, contributing to high rates of suicide. Those waiting a diagnosis often struggle to regulate their emotions and behaviours without proper guidance and support. The services provided post-diagnostic are often insufficient, leaving individuals feeling underserved and marginalised. It's disheartening to feel dehumanised and invalidated by a system that should prioritise our well-being. Whilst training on autism exists, it's often not effectively applied, highlighting the need for a filter system to ensure only competent professionals are entrusted with the care of others. Overall, there is a pressing need for comprehensive and inclusive mental health services that prioritise the needs of autistic individuals and hold healthcare professionals accountable for providing appropriate support and understanding. So thank you to people locally in providing feedback to us in their experience and understanding of the healthcare system. We absolutely know and recognise in terms of the recommendations from the JSNA, which directly refer to reviewing mental health pathways, that one of the main things that we need to do first and foremost is listen. Thank you, Anne. Wanted to share a piece of work that we've undertaken, again, in partnership with Autistic Nottingham, and some of that work directly with IMROC. IMROC are a national charity, but based locally, and are leading a national rollout programme of autism peer support workers, people who might have lived experience themselves personally, people who might have lived experience in their family. Several years ago, we undertook a review of deaths of autistic people that died by suicide. And one of the key things for me as a speech and language therapist looking at that review was awareness about reasonable adjustments and what reasonable adjustments actually are. So we've worked jointly with colleagues. Cathy, again, on behalf of Autistic Nottingham, has been central to this work. And we see that there are 6 key areas in which to offer reasonable adjustments in healthcare and in mental health care. Work around adapting communication, work and adaptations around assisting daily living, supporting people to address emotional regulation. We need to understand, and as a healthcare workforce, we need to be able to understand and recognise autistic burnout to be able to respond to it. Work around supporting people to anticipate, to prepare, and to be able to assess people's therapeutic need together. And then to think within that, and we'll come on to applying reflective practice. So we're looking forward to testing. We aim to use a QI methodology to help us think about the real learning we can take from implementing the reasonable adjustment toolkit. Thanks, Anne, if we move on. And then there is another clear recommendation about learning and development. So Anne has spoken earlier about the Oliver McGowan offer, which is mandated. And I think in Nottinghamshire, we've tried inclusive of a system rather than just to focus purely on a healthcare system. However, we recognise in the steering group for Oliver McGowan that awareness training brings awareness, but we need to think about much wider levels of support and to influence. What we're looking for in a system is creating cultural change, and therefore we need to be thinking together about how we develop infrastructure to create and to support that cultural change. For a number of years, our colleagues across the integrated care system have supported a small number of people to train as licensed practitioners in an approach called SPELL. That's structure, positive, empathy, low arousal, and links. That could really be an evidence-based approach to care planning. We don't have infrastructure at the moment to deliver SPELL training, but we do have a number of people that are enthused and want to be able to offer that across the integrated care system. Alongside that, at the same time as the rollout of Oliver McGowan, there has been a national Train the Trainer programme run by Anna Freud. I think I've got a few colleagues in the room that are co-trainers with me. The training is powerful, and the evaluation that we've received from running that training twice now in Notts Healthcare pays dividends in terms of response. We see people who are ready to learn. We see people who give honest feedback about the support that they think is already available. And we see people who are gaining confidence in terms of thinking about their next steps in how they provide adjustments in their care and how they recognise support to an individual who is autistic, but recognising much wider intersectionality. We really, really think that we need to be paying attention to unmet need, to demand and to capacity, and to think about how we grow as a system differently. One of the ways that we are exploring at the moment is through an international project called Echo Autism. An echo is a very, very structured way of creating learning loops, where you may have a panel that is available to you, and then as a community, we have structured time out for discussions that are related to neurodivergence and neurodiversity. It is absolutely essential that people with lived experience are central and part of that. So we're engaging in some learning steps with the international team that's led by University in the States to think about our next steps and whether we in Nottinghamshire might want to engage in Autism Echo. We've got some good contact with one other system in the West Midlands throughout England that has really started to scale up how it uses Echo Autism. Thanks, Anne. And we just wanted to highlight that actually, I think not one part of an integrated care system responds to the health inequalities, the needs, the recognising neuroaffirmative practice by itself. We need to do this together, and we need to do this in partnership. One of the partnerships that we feel very proud of is the development of the NOTS Neurodiversity Network, led by colleagues at the university, but colleagues across the integrated care system belong to. We think that we need to be influencing future shaping about research priority setting and how that relates to the very reality, and I'm looking at the chat, of our own lived experiences and the reality of providing services. Thank you.
Thanks, Vicky. I'm very aware that we have overrun slightly, so I'm going to stop sharing my screen and open up to the chat. I don't know, James, if you've managed to see any questions, themes.
Yes, so thank you. There are 6 questions which have emerged, and there's been some discussion, and thank you for everyone who's contributed to the chat currently and who are likely to going forward. The panel will of course read all of the comments, so if it's not a specific question, please be assured that all of those comments will be read properly. I'm going to pop the question in the chat. So the first question related to co-production, and there was an ask as to why there was no co-production for this chapter creation. So over to the panel, please.
Thanks, James. So we have been talking to some people in designing our JSNA. There was a survey that went out. We have obviously consulted with experts by experience who sit on our board, but the co-production was really limited in the JSNA. And I think part of that is the function of a JSNA is to really understand what we know now locally, but the real opportunity for co-producing is around that strategy and actually working to agree priorities as a system and really think about what the priorities are of autistic people with lived experiences. We know the evidence that's telling us actually areas like mental health are real opportunities where we could have real impact locally, but actually what are autistic people in Nottingham, Nottinghamshire saying are the priorities for them. So I do think that there's a huge amount of opportunity to do some really co-productive work through that strategy and that next step, and it really must happen. It's really clear recommendation in the JSNA. I don't know if anybody else wants to comment.
Thank you, Anne. I think I'm really comfortable with that response. I think hopefully people will see here colleagues who are excited by next steps and absolutely believe that through collaboration we will produce a strategy that represents the next steps for Nottinghamshire together. Yeah,
thank you, Anne. Thank you, Vicky. Question 2 relates to when you were describing the health inequalities. So just to read it out, do all these trends just show the assessments and don't include factors relating to specific gender, ethnicity or cultural differences? And were the Autism Alliance looking into this? And if not, who is?
Thanks, James. Thanks, Nikki, for your question. I don't know if I'm understanding it correctly, so forgive me if my response isn't great. I think the JSNA does highlight some of the specific health inequalities for different groups, specific health inequalities for women, specific health inequalities for ethnic minority groups. But you know, it's a very long document that I'm trying to condense. I do think that there is a lot of work to try to make sure that when we do talk about co-production, we are reaching a diverse group of autistic people with lived experience across those different groups and across those different health inequalities, because they will all experience services and support very, very differently. And that's something I know. I'm very involved in the Autism Alliance. Happily, I've been allowed to be. Something that the Autism Alliance really wants to do is kind of grow the number of people, the difference across different cultures, different experiences, different lived experience, to reach a much, much broader autistic population.
Thank you, Anne and panel. The next question really relates to the experience of children and the environments, including schools, and how they transition into become adults. So there is a comment which I've just put in the chat And I just wonder if the panel could just give a view on reading that. I will just read it out just for reference and for the recording likewise. So there's a significant amount of work around increasing accessibility to EHCPs for children on an autism spectrum disorder pathway or diagnosed. This needs to be urgently carried out to provide meaningful and appropriate education provision for young people alongside addressing access to appropriate mental health provision for autistic children. The environments of children's schools and alternative educational provisions need to be urgently addressed. Mainstream schools and colleges are not always suitable for young people. Autistic people, EOTAS's provision needs to be more acceptable and invested in. And there is obviously quite some discussion and support for others who recognise similar challenges. So I wonder if the panel could just speak to our understanding and if there's anything within the JSNA chapter which may speak to this as an area.
I think one of the recommendations of the JSNA is to really kind of have a focus around education, the experiences of education for autistic young people and children. I think we recognise the challenge. You know, National Autistic Society have published a report about the experience of autistic children and young people, you know, referencing kind of the higher prevalence of exclusion or those grey exclusions. So we recognise the challenge and the need to make reasonable adjustments in schools. I think that really has to be something that we run with in the autism strategy. I know that in the Autism Alliance, it's a key area of focus for a lot of people. People really want to talk about education and children and young people. So it might be worth, if you're interested in being involved in that, to get in contact with me after this, and we can kind of link you in with the Autism Alliance to see how your voice can be carried into some of those discussions. But I absolutely think this is part of the next step of the strategy.
We also have the Autism in Schools project in Nottingham as well, where each school has a link worker that works with the teachers and families.
James, can I just add, just talking to some of our teams that work the key worker scheme, for example, just learning about some of the work that's happening at the moment, children, young people leaving services with clear profiles, highlighting their neurotype, highlighting diversity. As a speech and language therapist, I have really learned from the evidence that recognises, in terms of adjustments, we need to think about adjustments that are associated with people's communication differences, people's sensory differences, and people's executive functioning, people's planning, people's sequencing. The more that can become central, and I'm really recognising that there are huge areas of wonderful practice, but more that is central to supporting people in terms of planning and enabling transitions. I look forward to thinking about how that work emerges. I think also, while we focus around children and young people, I think there's a recognition in the JSNA about services, but equally about neurodiversity, neurodivergence existing within families. And I think that's equally an important point for us to follow up on. Sometimes we might be supporting somebody in a mental health services, an adult mental health service, but equally we're providing support to a wider family system. The connectivity of that is sensitive and important.
Can I also just comment on the Partnership for Inclusion of Neurodiversity in Schools as well, because that's a project that has been running for the past year in the county with 40 schools and is continuing this year too. And that project is really looking at skilling education staff up around meeting the needs of neurodivergent children. It's also as an element delivered by the Parent Carer Forum to make sure that families are supported as well. So we're really hoping that we can embed that learning into the system as well. So that's just another area of work to feed in around children and young people. I think you can probably see from our responses that children, young people and schools is an increased area of focus, but I think we do recognise that there is more to do. Thank you.
Great, thank you, panel. The next question relates to mental health services. So does autistic regression or autistic burnout fit under the mental health teams, with a comment about some challenges to refer into those specific teams?
I think that's a really important question. And thank you for the question. I think it's a question that comes with, rightly, with challenge. I think at the moment we do see autistic people in mental health services that are experiencing autistic burnout. I think that we need to grow recognition of understanding autistic burnout and understanding support. I think that your statement relates, I think, to the question also from Paul above. So if it's okay, James, I'm going to just bring that in. In terms of understanding true population health, I agree, Paul. I think that the next stage of our strategy needs to focus on partnership work. And in terms of neuroaffirmative practice, actually, I think that we maintain a position where we continue to focus on adaptations in mental health services, but equally within our strategy, we are ambitious about a community sector offer, living well in the community, and the role of third sector within that.
Thank you, Vicky. Panel, we've had a message response to this, so it relates to the open invite for information relating to the Autism Act 2009, and there's someone leading on a response to this committee. Charlotte, you've kindly put in the chat that this is something you're working on, isn't it, Vicky? So I don't know if you just wanted to add anything to that.
Yes, I'm happy to. So in terms of the governance that Anne referred to before, there is a group called the Operational Delivery Group that reports into the Learning Disability Autism Board. We were planning to send a coordinated response, so each part of our integrated care system feeds into that operational delivery group. I'm happy to send people. So at the moment, I've put the questions into an MS Teams form. I'm happy to send people the link if they want to make contact with me.
Great, thank you, Vicky. We'll make sure that is available, and thank you very much. The next question relates to carers and support workers. So has there been any work with carers and support workers who care for people with severe learning disabilities who are autistic? And then a comment around an organisation locally who is available but only works with people without a learning disability diagnosis.
Yeah, so I think the Autism JSNA does predominantly focus on autism. There is some reference to co-occurring learning disability. The good news is that a separate joint strategic needs assessment is being devised for people with a learning disability as well. So there will be more opportunities to go into, I guess, greater depth around individuals with co-occurring learning disability in the future. Obviously, our board at board level is joint learning disability and autism, but the main focus of this JSNA is around the autistic population without learning disability does reference the co-occurring conditions, and you rightly raised, you know, that there's a whole kind of separate list of services that those people may or may not come into contact with, and a whole list of different kinds of needs that population may have. So yeah, it has been, I guess, dealt with slightly separately.
Thank you, Anne. Yeah, and I think we know the evidence nationally would suggest around a third of adults with a learning disability will also have an autism diagnosis. So I think there's strong recognition around the correlation between the two areas. Question 7 is a really nice one. It's how can I volunteer to share my experiences with you? And I note, and you've put contact details, haven't you, on one of the slides? I wonder if you wanted, or the panel wanted to speak to that.
Absolutely. Please get in touch with us. I will put my email address in the chat. And I would really love to have a conversation with anybody who wants to talk about their experiences. See, I work in adult social care, so, you know, probably a bit more aligned to what's happening in adult social care, but obviously I work closely with colleagues across the system, so I can share any information.
I'd also be interested in hearing from people with a learning disability as well. For the LD JSNA, so I'll pop my email address in the chat if you want to get in touch with me as well.
Great, thank you, panel. I'm conscious we do have 5 minutes left. There's a question around, can I share the information? You definitely can. so I won't put that to the panel, but thank you. So there's a question around sensory and accessibility. So the lighting in all of our public spaces relies heavily on fluorescent and now replacement CFB bulbs. This is totally unacceptable for this group. When will this be changed? And I note, obviously, we have health and social care represented on the panel, which sometimes have limitations in those public spaces. But over to the panel, if there are any thoughts on this question, please.
Maybe I start us, but I think there's a real challenge that you're bringing, and I accept that challenge around wider community-based environment spaces. I suppose what you lend me to think is, how do we share the learning that we have together already? I think the evidence base is very clear about our need to be focused together on thinking about sensory differences. I've had opportunity through colleagues in the health service, and I really do recognise that my response will be health focused around sensory friendly environments. So I think Jenny, Rudd, the comment that you put in the chat too, there's work that we've undertaken around creating sensory audits, and that for me is a part of cultural change. It's been incredibly useful to audit some of our ward environments together with Kathy, again from Autistic Nottingham, and think very think in a way that is productive about what changes we can make. And we've made very similar comments. And I think sometimes there is overlap, both in terms of thinking about an ambition to be neuroaffirmative and also link that to a sustainability and green agenda, and think about how we can align that. But we recognise that there are relatively simple changes that we can make, but that require infrastructure and require coordination. I think there is some work that we could do together about celebrating some of the learning and how that celebrating can be part of cultural shifts. We're excited to continue our sensory friendly environments project into the next year ahead. But again, recognising the health focus, thinking about how we can share some of that learning elsewhere, and how we can grow some of that learning elsewhere together.
Great, thank you, Vicky. So that brings us to the end of the questions which were supplied, and nicely we are into time. I think I will ask the panel, oh, excuse me, Anne, if you wanted to come in on that question, I do apologise. Do come in.
No, I didn't. No, I just wanted to say something to everybody before we finish today, if that's okay.
Yeah, so I will definitely invite you as a panel to just give a closing comment. I think more broadly, a key commitment. So I'd just like to thank colleagues' work on this very important chapter, and the spirit of how we have worked together as partner organisations. I should add, I'm a commissioning manager at Nottinghamshire County Council, if I didn't at the front. And we don't want this to be a document which sets out really, important recommendations which in 4 years' time haven't moved forward. There is a real commitment to not necessarily being able to solve everything, but to be really clear on how the resources and the energy we have collectively as a community and as a system are aligned to make a difference and make that difference count. So thank you for everyone's kind of contribution. This is not the end of the journey, it's more the start of the what next. So can I just ask Anne and the colleagues who have presented, thank you again for your time. If you've got any closing comments you'd like to make to the group.
Yeah, I just wanted to invite people to get involved and help us on this journey. This isn't, like I say, one person's job. All of our panel members work in different organisations, and we're all trying to influence change as best as we understand it. But we invite people with lived experience. We invite colleagues across the sector, people working, experiencing different things in their everyday work, to get in touch with us, or in their everyday lives, get in touch with us, share their experiences, and think about how we can work together to shape some of this. Because, like I say, it's never going to be one person's job. It's going to take all of us to keep tapping away at this to try to improve the experience of autistic people. And we rely on you in your everyday practice to think about how you can do that.
Great, so that brings us to a close. Thank you again to everyone's contribution, time, and again to the panel's work on this. This recording will be made available, and the slides which have been presented will likewise. And please do get in contact with colleagues who have set out today their contact details. If you've got any further questions or comments or would like to support more widely, it's very much invited. Thanks, everybody. Bye-bye.
Thank you.
Thank you.
Thank you.